Welcome everyone. Hello everyone. Welcome to today's webinar titled Pepfar Data Lifecycle. Thank you for making time for our webinar today. My name is Mer Indicators, working with ASAP. I'll be walking you through the announcement for today's webinar. Soon after my announcement, Jason from USAID will provide updates on USAID. And our presenter for today, Joshua Davids and Shiva McDavid, will be walking us through the webinar on Pepfar Data Lifecycle. For our announcements today, thank you for making time for our webinar. Welcome once again. Please feel free to use the Q&A platform for any questions. We'll be happy to answer them, most of them live, and all of them will answer them in Q&A and provide that to you after the webinar as a Q&A write-up. Please take some time to complete the poll for us during the last 30 minutes of the webinar. We also wanted to announce to you that ASAP has 2,000 scholarship opportunities for courses with one of ASAP's consortium members, Foundation for Professional Development. Applicants for these 2,000 scholarship opportunities must be living in Africa and work with an NGO or government. I'll be talking a little bit more about that in a minute or so. All webinar presentations, recording, Q&A, and resources are available at ASAP's website with the link right there below on as you can see on the screen, on your screen. We'll also provide this as part of our resources to you after the webinar. Let's talk a little bit about the scholarship courses provided by ASAP through Foundation for Professional Development. We have 11 courses under Foundation for Professional Development Business School that are available for you to apply. That includes Introduction to Project Management, Introduction to Financial Management, Managing Usaid Cooperative Agreements, Sub-Award Management from Cradle to Grave, Fighting Fraud, Public Finance and Accountability during COVID-19, Preparing NGOs 10% de minimis request and how to calculate and allocate shared costs as direct costs. In addition to that, the course is also available how to prepare for your first USAID audit, understanding and complying with your non-US mandatory standard provisions, internal controls under revised Green Book, and monitoring and evaluation for accelerating support for local partners. We also have 9 courses under FPD's Information Technology School that are highlighted for you in the slide that's showing right now. These courses include short course on Microsoft Teams for end users, also a short course in Excel Core, a short course in Excel Advanced, analyzing and visualizing data, short course on data analysis, database fundamentals, introduction to data science, as well as using data in software applications and working with non-relational data. A couple more scholarship courses also available with FPD's School of Health Sciences, a short course on COVID-19 for healthcare professionals, as well as a short course on mental health resilience for healthcare professionals, and a short course on gender-based violence in COVID environment, as well as a short course on how to set up a screening, testing, treatment site, 7-day mental health kit for surviving lockdown, in addition to COVID-19 short course for frontline workers, and a short course on respiratory support for COVID-19 patients, a non-interventionist approach to ventilation support. Finally, we also have courses through FPD's Occupational Health, Safety and Wellness School, and that course is a short course on COVID-19 in workplace. We will provide this information after the webinar as well, including the link on where to apply for this scholarship. We also would like to make some announcements on upcoming ASAP webinars. would start at 8:30 to 10:30 Eastern Time, the same time we're on now for this webinar. On 2nd September, we'll have a course on French fraud, preventing whistleblower programs, detecting, reporting, investigating, managing cases. And on 9th September, we'll have a Pepfar expenditure reporting webinar. We welcome you to all these series of webinars. And I'm going to hand over to Jason for Usaid announcements.
Hello, good morning, good afternoon, everybody. My name is Jason Porter from the Office of HIV/AIDS, and I just want to talk briefly about some updates on guidance and resources. So from you will see PEPFAR and SGAC COVID guidance is continuing to be updated. If you use the link, which will be sent around in the slides, you'll see that we're still updating every week with the August being the latest update for guidance. And you can also access all past guidance at this same website. Next slide, please. Also, from USAID directly, our USAID task force is also providing updates on guidance and resources. There was recently a call with implementing partners. The topics included USAID's COVID-19 response, the America Acts campaign, and the agency's Over the Horizon efforts. You can find copies of these presentations by clicking on the link provided in the slide. The USAID Agency Task Force has also issued guidance regarding PPE and covered materials for implementing partners, as well as a set of frequently asked questions to help with any questions staff or implementing partners may have. The updated guidance includes additional information on how to make determinations under Exception 1 and Exception 2, more flexibility on regional procurement, and updates to redirection processes for PPE. Next slide. Okay, that's it. I'll turn it back over to you, Mary.
Thank you. Joshua, over to you.
Good morning, everyone. Thank you for joining us. My name is Joshua Davis. I am an analyst at the USAID in the Office of HIV/AIDS. I'm joined today with two of my colleagues, Christy Knight, who is an SI advisor on our team, and Nishiva McDavid. And they will be helping us today facilitate this training and answer any questions that you may have. So a quick overview of the objectives today. So we're going to try to help you understand the PEPFAR MER data and the PEPFAR data management lifecycle. We're going to talk a little bit about data reporting quality. We're going to review the MER 2.4 indicator reference guide. We're going to talk about the HFR data requirements, and we're going to let you know a little bit about how USAID is analyzing the data. The objective today is to sort of familiarize you and orient you to these processes and systems, and try to give you a sense of kind of what happens on the headquarters side of things, so that you are again oriented to why you are being asked to do the things that you're doing. At headquarters, we're a little bit separate from some of the activities that you do, and so our hope is that by explaining to you what we do, it will make a little bit more sense, the things that you're being asked. So let's see, a couple of ground rules. There's a few files that we'd like you to download. Sort of now, take a few minutes to download those files. We will be referring to them. The first, where you see the tinyurl.com, is the MER 2.4 guidance. It's a very large document that we will be using later during the presentation. The second document is the Datum data calendar. Both of those are in the chat box. So if you could go ahead and just take a minute to download those files, I think it will be helpful when we get to some of the review that we're going to be doing. So I'm just going to pause for 1 minute and let everyone download those files. All right. So the first thing we're going to talk about is the Pepfar data streams and life cycles. Now, again, the idea of this is to help you understand MER data and the data management life cycle. As I said before, this is an explanation and orientation of kind of what goes on after you do your work, you collect the data on the work that you're doing, and you enter that data into the system. Now, again, this is very sort of headquarters focused, but we're hoping that we can help you understand kind of why we do what we're doing. So starting with kind of the overarching goals of Pepfar, there is a narrow window for the opportunity to reach the UNAIDS 90-90-90 goals. And so all of what we do is kind of grounded in the idea that we want to use data to focus on programs in the geographic areas and populations with the greatest HIV/AIDS burden. And so that is really, you know, Pepfar, we all know, is very data focused. If you're coming to Pepfar from a different health area, as I did, it is rather important how different Pepfar wants to try to collect data and use data. It's a very key component of everything that you do. So we're going to start with the types of data that Pepfar collects. And we're going to start by kind of talking about some questions. And these are the sort of questions, as you read through these, you can imagine that anywhere along the cycle of Pepfar, either headquarters, your agencies, ministries of health, or yourselves as implementing partners. These are the types of questions that you might want to know or have answers to. Where should Pepfar work and prioritize? What type of work should Pepfar be doing in those places? How is Pepfar doing at achieving its goals? Is Pepfar conducting quality services at the site or community? Is what Pepfar doing sustainable? And how much does Pepfar work? How much does Pepfar's work cost? So we basically are, again, because this presentation is grounded in the idea of these different work streams, we have a work stream, a data stream rather, that corresponds to each of these questions. So for where should Pepfar work and prioritize, we have epidemiological data. That's either from a FIA survey or from the spectrum estimates that are produced every year. What type of work should Pepfar be doing in those places? That's the budget. The budget is the guide to what your priorities are. How is Pepfar doing in achieving its goals? That's the MER data, monitoring, evaluation, and reporting data that we're going to, this is frankly going to be the bulk of the focus of today's activity, and probably where you spend a lot of your time in regards to data. Is Pepfar conducting quality data services, is Pepfar conducting quality services at the site community? That's SIMS, the Site Improvement Monitoring Surveys. Is what Pepfar doing sustainable? We have above site monitoring for that. We're only going to really touch on above site, but it is an important thing for you to know that exists. And then how much does Pepfar's work cost? And for that we have expenditure reporting. So starting at the sort of very beginning, the way that we collect data in Pepfar is all grounded in what we call the organizational hierarchy. And you can see it represented here. The organizational hierarchy is a really key component to understand because data have to be collected at a certain level. And every data source in Pepfar, all these data sources that we spoke about earlier, EPI, budget, MER, SIMS, above site expenditure, are all collected at a certain point on this geographic organizational hierarchy. Obviously, it starts with global, and we have regions as well. And then really it's the third step along this route that's probably gets to be the most interesting, is the operating unit. Operating units in PEPFAR are countries or regional programs. We have subnational units. And again, a subnational unit is an administrative boundary. You could sort of think about it as below your country, what's the next largest administrative boundary that you have. And then we have the priority subnational units. And priority subnational units are an important concept in PEPFAR because they get used very frequently. Priority subnational units are really just an administrative area. It's the administrative unit that PEPFAR decided to prioritize. So in most cases and in most countries, the priority subnational unit is a district, for example. And so you would have kind of a country, province, district. So in this case, that would be operating unit, subnational unit, and priority subnational unit. And what that means is that when PEPFAR decided to shift its focus to the geographical areas where the HIV burden was the greatest, it needed a subnational unit to choose. How are we going to prioritize? Are we going to prioritize certain regions, certain provinces, or are we going to prioritize certain districts, certain states, certain counties? It really just depends on the country. But that's what the PSNU priority subnational unit means. It's just that it is analogous to an administrative boundary that we decided to focus on. And below the priority subnational unit, we have community. Many of you will be working in community-based programming. So what that means is that the work that you're doing is at sort of the community level, and then therefore you will report that data against a particular community. Again, each country has a slightly different definition of what the community level is. Sometimes it is the same as the priority SNU, and sometimes it is one level below. So that a good example is you can have districts and sub-districts. So district would be your priority SNU, sub-district would be the community. You could have districts and wards, where district again is a priority SNU, and ward is the community level. But then sometimes you can have districts are the PSNU and districts are also the community. And it really just depends on your country context. And then finally, we have facility. And again, facility in PEPFAR tends to have a very specific meaning. And that is a freestanding health facility. So that is, a building in which healthcare services are delivered. So I will pause there and ask Mary if there are any questions so far.
The only question we have is with regards to the link that you shared. It takes us, here's a question, the link takes us to calendar. Was that the intent?
Yes, there should be a calendar document that we're going to reference later on in the training. So it's the PEPFAR data calendar.
That's it for now, Joshua.
Now we're going to talk a little bit about where the PEPFAR data are collected. And this part of the presentation gets into a little bit of the headquarters level systems, but you will have exposure to these systems. And it's important for you to understand kind of how they work. So again, along the left-hand side, you can see that we've got our budget data, epi data, MER data, expenditure reporting data, SIMS data, and above site. Now, each of these different data streams has a system that it corresponds to within PEPFAR. And so the main one that you're probably going to hear about and become the most familiar with is Datum. Datum is a system that's based on DHIS2, which you may be familiar with because many of your ministries of health will use DHIS2. But Datum is basically taking that DHIS2 and modifying it for PEPFAR specific use. And this is where we host the MER data, the epi data, and the ER data. Next, we have FACS-Info, which again is another system that the US government uses for budget data. And we have what we call agency systems. Now again, with SIMS, the agencies were asked to build their own systems. So We, USAID or CDC or DoD would have its own system for those things. Now we're kind of getting into how you look at the data for those systems. And you can see for FactSinfo and Datum, they are both, you would enter the data into those systems. So the middle column is the actual computer system where the data is entered and stored. And the place that you use the data, or the place that you interact the data, is these Pepfar dashboards. Now these are available to the general public at data.pepfar.gov. And it is a way for you to kind of go in and see how the data that you have entered into these systems is being looked at and being used. That's just a very quick overview of the different places the data is stored and where you're able to then interact with the data. So next we have the Pepfar data calendar, and I hope everyone was able to download this. This is a really key document for understanding the Pepfar data lifecycle, because everything, every data point that you would be asked to collect on behalf of Pepfar has a corresponding area in this calendar. Now it's a little bit, it's very busy. There's a lot going on here, and it's a little bit hard to sort of understand. I'm not going to give a thorough overview of every aspect of this calendar, because again, there is a lot. The important components to note are if you are a program that has targets in Mer data, so you have a testing target or a treatment target or a prep target, you are going to be required to enter data into Datum based on this calendar, which again, you probably, if you're doing this now, you should be familiar with this. But the idea and the reason for showing you this is that every aspect of what happens with our systems has a requirement that's based on this calendar. So, it tends to dictate, when things when you are able to do certain things in the system. So, when you are able to enter data into Datum, for example. So, we're doing your work, you're collecting your data for Q4, and you want to be able to enter your data into Datum for Q4, but Datum has to open. And there's a date at which Datum will open for Q4 data entry, and you can find that date in this calendar. And that holds for SIMS, and that holds for the ER data as well. So next, we're going to talk a little bit through what this process looks like, the Pepfar data cleaning process. So kind of what goes on at Pepfar, what we're doing and who's doing what. And again, this is just meant to give you an overview. The reality is that the specific aspects of what you do for your data entry and data cleaning oftentimes will be dictated to you by your USAID mission in the country. And again, this is just sort of an overview of the entirety of the process. The reality is that you will be mostly focusing on the first 4 of the circles. So if you follow the path around from the upper left-hand corner, this is where we start. If you follow the path around all the way, it snakes around until you get to the lower left-hand corner. You are in the upper left-hand corner, and we're really going to focus on the first 3 of those circles, because those are the ones where you, as implementing partners, will be involved. Now, again, the very specific aspects, I encourage you to post your questions in the chat box, and we'll circle back to those, but the very specific aspects of what happens, what you need to do, the details, you will work with your USAID missions to determine. But this is just an overview. So the first step is IP data collection and entry. This should be familiar to you because many of you will be doing this now. And so this is really just collecting your data. You do your work, you go off into the community and you test people, you support testing services at a clinic, and the work that you're doing is being recorded, either by you or by the local health management information system. And so, you should have processes in place now where if you're collecting the data yourself, you have some sort of system within your organization to collect the data, and you do your work. So the second circle, the IP data review, validation, revision, and analysis, is again, your internal processes as implementing partners, are your review of the data, you're sort of, if you look at your data every week, this is this process. If you look at your data every month, this is this process. But really, it's just the steps that you take internally to look at your data. The very third circle on the upper right-hand corner is the IP submission to US agency. So this is the first step of you interacting with Datum. So you will be putting the data, entering the data into Datum. And as soon as you're ready, as soon as you're satisfied with the data that you've entered, you submit it to the agency. And so this is where, if you are a bilateral program, your AOR or the strategic information team member in the mission that you support will be reviewing the data. And they have a couple of processes for review, which I'm going to cover in just a minute. But this is really just to outline the steps, and then we can kind of get into the details. And so what happens is they review the data. And again, we're still at the third circle, IP submission to US agency. So what they do is then they move to the US agency data review and validation. And so this is where your colleagues at the mission will be looking at this data. And they have a number of different things they look for. There are some controls built into Datum that don't allow certain types of data to be entered. For example, if you have a target for testing, you can't enter the word red. It will only take a numeric value. And so when it gets to the US agency data review and validation, what USAID is checking for are things like, if you report 100 HIV tests, but then you report 150 positives, that's going to look like an error to us, because outside of some circumstances, you would not have more positive tests than you will have overall tests. So some very simple business logic checks will be done. And what happens is, and this is where this red arrow that kind of goes up the middle, this occurs. What will happen is, if they detect an error, they'll probably contact you and say, oh, listen, I see that you have 100 tests, but 150 positives. And you can probably go, oh, well, that was a data entry error. In fact, we meant 1,000 tests and 150 positives. And so what they do is, within Datum, they push the data back to you, because as the implementing partner, you are the only ones that can enter and modify and change data within Datum. So really what they're going to be asking you to do is to make the changes. They're going to help you identify where there's data errors, but then you yourself will have to make them. So if you see the middle red arrow there, they're pushing the data back to you, you review it, and you resubmit. And then they look at it again. And if this is the only error, great. And we continue along the path here. And so what happens then is, it goes from, this is all within the mission still, it goes from the US agency, so your USAID colleague in the mission, to an interagency review. And this is the Pepfar coordinating office in the mission. They review it. Again, if they find an error, they push it back to the agency, who in turn pushes it back to you, and then this whole process starts over. And that continues in the lower part of our diagram, where it makes its way all the way up to headquarters, which is at OGAC. This is, again, not USAID's headquarters, but OGAC headquarters, who will check for certain things. If there are problems, they push it back to the interagency PCO in the country, who then push it back to the mission, who then pushes it back to you. So sometimes when you're being asked to do these different steps, your interaction with this will be only, you'll receive an email from someone asking you to change something, or you'll receive a phone call saying, hey, I have this question about the data. And just, this is again to give you a sense of what's going on. You will really only ever see the first 4 of these steps here. However, this is the rest of the process that impacts you. So next, we have a couple of questions that we want to sort of put out to the group. And the first one should be very easy. And the second one will require looking at the data calendar. And so I believe, Mary, we're going to let people respond in the chat box. So we'll just take 1 minute. So we want you to raise your hand if you've ever entered data into Datum. And then the second question is, what is the Mer Q4 data entry deadline for FY20. So I'll just give everyone just a minute to do that, and then we'll talk about the responses.
Six participants have raised hands so far.
All right. Do we have any responses to when the Q4 data deadline is?
October 14th, November 6th, November 13th, November 6th, but closes on November 13th, 13th November, 6th November, November 15th, another November 15th, and October 15th. I think that gives us a sense of the answers. October 15th, October 20th, and we have 7 hands raised. Back to you, Joshua.
Okay. So, thank you all for those of you who have already entered data into Datum. We're going to have a discussion session at the end of this where we would like you to help share some of your experience with what you've done and kind of, I think many of your counterparts at other organizations will want to hear. The data entry deadline is November 15th. So what that means is that on October 1st, the Datum will open for data entry. And at that point, you will have 6 weeks to enter the data into Datum. Now, again, what we're talking about here is the system will open and it will close. But however, you might have an internal deadline that comes to you from your AOR, COR, or the SI team that you're working with in the mission. So usually they won't ask you to enter data before October 1st, because if you think about it, Q4 ends on September 30th. That's the last day of Q4. And so it wouldn't make a whole lot of sense to enter the data before then. So in fact, I made a mistake. It's November 13th, Friday the 13th, not the 15th. It's the 13th. So that's the last day that you can enter data in. Now, again, you might have an internal deadline from your AOR COR that's before that. They might say, in fact, we want it done by October 13th. And you'll have to honor that because the AOR COR is the person who's responsible for your award. However, the system, in terms of what the system opens and it closes, and you can think about this as almost like a drawbridge. You can, once it's open, once it's closed, and so you can't really do anything else. So now we're going to talk about data cleaning and review. So we're going to cover 2 ways that you can use the system and the tools that we have to do data cleaning and review. And again, I'm really just going to touch on these things to introduce them to you. With the time that we have, we don't have the ability to go very in depth with these, but I am going to introduce them so that you know that they're there. You know that these things are accessible to you and that you can use them. The first are what are called the Datum Mer favorites. Now, Datum is an interesting piece of software, and if you're familiar with DHIS2, Datum will look very familiar to you. Now, within Datum, you are able to create a particular kind of analysis, either a visualization or a data table, and save it as what's called a favorite. This is basically like bookmarking a website. It just allows you to create something one time, save it, give it a name, and then you can always go back to it. So what has happened is OGAC has created a series of what are called data cleaning favorites. And these are favorites that they created for you. And it's by indicator and by quarter. And what you see here is a screenshot from Datum. Now, Datum also has the ability to create dashboards. Now, you yourself, as a Datum user, can create any dashboard that you want. However, again, OGAC, Pepfar, has created for you some dashboards that they thought would be useful. Now, if you orient yourself to what you're seeing on my screen here, this is just a screenshot of a web browser. So when you log into datum.org, you will see something like this. Now, in the very top, all those little ovals that you see with different things in them, those are my dashboards because I'm logged into my Datum account. You will see different dashboards. However, everyone will see the green circle, the green oval with the red box around it that says Mer results and target review favorites. Now, this is a dashboard that OGAC created and that they push to everyone's dashboard. So everyone should see this. If you click on that, you see kind of what you see below. And what I've done is I've just taken a small screenshot of the testing. And what you can see there is it's by indicator and by by technical area and by disaggregate. And then you can see that your table here is by quarter. So if you were interested in looking at your HTS-TST top line numerator for Q3, you would click the open link right there. And the words that say open are hyperlinks. And so what that will do is when you log into Datum and you click on that, it'll take you to a data review table that you can then look at and decide, if this makes sense to you. If it doesn't make sense, you can revise the data and resubmit it and then check this again. But this is one of the tools that we have, to help you. So if you were to click on, for example, the FY20 Q3, if you were to click on that, you would see something like this. Now, again, I am a headquarters user, so I see all the data for all the different countries. With the Datum account that you have as an implementing partner, you will only see your data. And this is where this data cleaning favorite should be helpful for you. Because instead of having to create your own analysis within Datum, you can see one that's been created for you. And for example, what you can see here is that this is the January to March HTS-TST results. And so, and it's broken down by KP disaggregates. So you can see here that this particular group did 17,000 positives on 202,000 tests. So this is a way that you can kind of just check to make sure that this is the data that you wanted to enter into Datum. Oops, sorry. Next, we have something called the data review tool. Now, when you log into Datum, in the upper right-hand corner, there you have a series of what are called apps. And these are DHIS2 and Datum apps. One of those is called the data review tool. And you access it via the genie. And the genie is the little lamp that you see there. The data review tool is a Excel-based tool that you download. And it contains checks for data quality. So basically when you download it, rather than interacting with datum.org, which is an online system, the data review tool is an Excel tool. So you will, once you download it, you can open it up on your computer and manipulate it however you want to. So what this means is that as soon as you're ready, as soon as you want to check your data, you can enter all your data in, download this DRT tool, and then and check what you've submitted. So take a look at sort of what this data review tool looks like. Again, because I have sort of a headquarters account, I see lots of different partners. But for you, you would just see the data for that your organization had entered in. But it does allow you to look at it by site, and that's the very interesting part about using the data review tool. Is that it does let you sort of look across this. It has a number of different what are called checks. So these are the sort of the validations that we talked about. And so you can see the name of the check here is for PMTCT post ANC modality, current period results reported, but no targets. And so where it says number of cases violating the check 26, what that means is you have, this partner has 26 facilities where they reported ANC results, but they had no ANC targets. We haven't talked too much about targets, but it is something that's important to Pepfar. And a lot of times, if you're working in a health facility, you should, the health facility will have targets, but if you are working there and there are no targets, your COR, AOR might ask you why. You're working there. Again, this is changing a little bit with FY21, which starts on October 1st, because we are not having site level targets anymore. We will still have PSNU level targets, but we won't have site level targets. So I'll pause there for questions.
We have one question. What is the difference between SNU and priority SNU?
That's an excellent question. So the SNU means subnational unit. And as you can tell from the term, it's just a very generic description of an administrative boundary. Within your countries, you have administrative boundaries. You have provinces or regions or districts or states or counties or wards or whatever. And so what that means is that when Pepfar decided to only focus in certain geographic areas as opposed to focusing on the entire country, they chose an administrative level that they wanted to use for prioritization. So, for example, I work a lot with Zimbabwe. And Zimbabwe obviously is a country, and in the country there are regions or provinces, and there's 7 of them, or 8, I think. And within those, they have a number of different districts. And so what Pepfar decided to do is they said, listen, the region doesn't really give us enough, it's not precise enough for how we want to focus our work. And so we need to go one level down. And we need to sort of say, look, really we want to focus on things at the district level. And so for Pepfar, what they've said is, okay, well, what we're going to do is we're going to prioritize at the district level. So therefore, the district became the priority subnational unit. And so what that means is it's just the general level at which they chose to prioritize. And like I said, it changes from country to country. And in your particular case, you could certainly include that in the follow-up questions, and we can let you know what it is. Does that help?
That's the only question we had.
All right. So a quick overview. Now we're going to talk a little bit about the indicators. So these are your MER, monitoring, evaluation, reporting indicators. And like I said, if you are doing, depending on the kinds of programs you're implementing, this will be a lot of what you, a lot of the data that you collect. Now, we've got, I want to say this is 42 indicators, changes a little bit, but you can see that they are grouped basically along the 4 technical areas going along the left-hand side. So prevention, testing, treatment, viral suppression, and health systems. So if you take any one of these indicators, we talk about something called disaggregation a lot in Pepfar. And so we're going to take TX new, and this is the number of new people on treatment. And so if you start with a TX new of 100, that's your total. So in one quarter as a partner, I enrolled 100 new people on treatment. So we also want the sex disaggregation because Pepfar cares about subpopulations and how we're doing in certain subpopulations. So of those 100, 60 were female and 40 were male. But Pepfar also cares about age. And so what we want to know is of the 100 and of the 40 male, how many of those were in the different age groups? And the age groups that you see on the left-hand side there are what are called the fine age disags, and those are usually, those are the same for most indicators, although it does change a little bit. So what you see here is basically what, if you start with that 100, you know, what you see in the finer age grouping is the kind of disaggregation that Pepfar requires for this indicator. And this will inform how you set up a collection system, because you will need to have this level of precision when you go to collect the data. Now, when it comes to entering the data into Datum, this is what a data entry screen looks like. So when you log into Datum and you go to data entry, what you will see is this. And this is a data entry screen for TXNew, so the same indicator we were just looking at, for one site, for one quarter. So what you see there is you see your the first row of boxes where you have female, unknown age, under 1, 1 through 4, etc. And below that you have the same thing for the male. And what you can see is that these age categories correspond exactly to what's in the data entry screen. So that's kind of how this all fits together. You're required to enter data at a certain level of disaggregation. And like I said, that's so that we can do the kinds of analysis that we need to do. But what it also means is that you, as the implementing partner, will have to collect the data at this level. So that brings us to, how do you know what the disaggregations are for certain indicators? And this is the Mer Indicator Reference Guide. And so this is really Pepfar's Bible. It's a very useful document, and I highly recommend that everyone on this call review it for the indicators for which you have targets. So if you have a target for a Mer indicator, you should really, really read that section of this document, because it will tell you everything you need to know about the indicators that you're going to be collecting data and entering data against. So we're going to take a quick look at the setup of the document. This is a generic template of what the what is in the indicator reference guide. You've got your fields, so just the indicator code. So that's something like TXNew. The name of the indicator, the numerator, the denominator, any changes. So again, we've gone through, this is 2.4. So this is, you know, obviously an evolution, represents an evolution. So the next field will define if things have changed. So if you used to work in Pepfar and it was recorded one way, you would want to check this to see if it's still recorded that way. The reporting level. Now again, this is facility, community, or above site. The reporting frequency, how often the indicator, and it's convenient in Pepfar because we've got quarterly, semi-annually, or annually. How to use. Now this talks about how to use this data, the data from this indicator to talk about your program, how to collect, how to review for data quality. This references the different favorites or the data review tool that we looked at earlier, and then how to calculate an annual total. And this just basically tells you if this is an indicator that's a cumulative indicator or a snapshot indicator. So we're going to take 1 second and take 1 minute rather, and let people sort of use the link that I posted in the chat box earlier to download this data reference sheets and try to answer this question in the chat box. And in looking at the answers for this question, I will also pause for other questions that may have been asked. But everyone let's take 2 minutes and try to answer this question.
And hi, Josh, this is Nashiva. I noticed some questions in the Q&A box that I'm drafting responses for, but feel free to respond to some of them if you want to. I can respond to Daniel Levitt's question about SNU and PSNU for clarification, if that's okay.
Wonderful, thank you so much.
No problem. Thank you, Daniel, for your question. If folks can't see, Daniel asks, thanks for clarification on SNU and PSNU. What is still unclear to me is if a given country then might have both SNUs and priority SNUs. In other words, does that mean that there are some districts that are higher priority than others? And to your point, Daniel, yes, technically, as Joshua mentioned, SNU stands for subnational units, which can be the state name, then the district name, then the region name, then the city name, then the community name, then the neighborhood name, depending on how your country defines its geographical boundaries and areas. The prioritization subnational unit is for Pepfar program planning purposes. So if we are setting targets and we have data at the district level and at the community level, depending on the quality of the data, we might choose the community level to prioritize our plannings because that data can help inform our targets to be even more, our targets could be more accurate as far as what we are capable of doing. To your question of does that mean that some districts are higher priority than others, Joshua and Christy, correct me if I'm wrong, but technically no, because every country, the prioritization SNU level is the same. So you won't have some targets that are set for community level as a prioritization versus some that are set for a higher geographical level. At the national level, the prioritization subnational unit is the same.
Thank you, Nishiva. Yes, that's correct. So again, the PSNU is really, it's just the level at which we decided to set them. And I'll be honest, it is less important in Pepfar today than it was sort of 4 or 5 years ago when I started. There are different types of prioritization. So I don't even remember what they are because we don't use them that much anymore. But you know, if you take a country with District A and District B, District A could have a very high burden and District B could have a very low burden. And so Pepfar would look at this and say, okay, we really want to do more work in District A because that's a very high burden. And so we might say that District A is an area where Pepfar wants to focus, as opposed to saying, you know, working in District A and District B and splitting the resources evenly. So we're going to put more of our resources in District A because that's where the highest burden is. So District A, you could sort of, I mean, I wouldn't say it's Pepfar wouldn't say it's a higher priority per se. They just say, they would say they would want to focus more of their resources there. But the district is still the district writ large is still the priority subnational unit. So it's not a particular district that is the priority. It's just the fact that district is the level that we're using to prioritize. It's a little bit of a weird concept, so I can.
Yeah. Keep going, sorry.
Okay. All right, so I did glance quickly at the chat box. Seems like most people got the response correctly, which is annually. And so again, the idea of this is just to sort of give you a brief overview of that reference guide. It is very, very useful. If you do have a question about collection, I highly recommend that you read that first. It's a useful guide, especially for some of the indicators that are newer or a little bit more complicated, like HTS index. If you have index testing targets or your organization is doing index testing, there's a very useful graphic in the reference guide that explains the index testing cascade that I'll give you a little hint. You can take a screenshot of it and use it as a training guide for, in turn, if you have sub-partners or other partners that you work with. It's very useful. Did we have any other questions before moving on?
Yes, we have one from Ganet Honorat about the DRT. Is it possible to get the DRT that we could adapt with our specific projects, or do we have to just develop our own?
Excellent question. So what you can do is when you log into Datum, if you follow the screenshots, and again, this presentation will be available to you afterwards as a PDF, as a reference. all you need to do is download your DRT. And the thing is that if you're a partner, if I'm partner XYZ, and we are implementing only in one province in Zimbabwe, when I log into Datum, my Datum user account is linked to my project and to the results that I reported in. So when I download the DRT, it will be just for me. So the answer to your question is, in fact, yes, you won't need to do anything to the DRT. It is only going to include the data for your project. And that's, I think, why it's a little bit, it's a nice tool, because you won't have to sort of filter to look at your data. It'll just be there for you.
And we have one more question from Umar in the chat box. Do we aggregate data from the project-based databases and then enter aggregated data into Datum? Excellent question.
And this is where I sort of said earlier that this is where, some of what you're required to do is going to be dictated to you from your AOR COR, and some of what you're required to do is because of the Datum requirements. Now, it really depends on your particular circumstances. Now, if you're talking about testing, it depends on how you are capturing your testing data. If you're testing data, if you yourselves as an organization have some sort of, if you have some sort of internal data collection tool that's either paper-based or electronic that you use, it doesn't really matter if you collect data at sort of an individual level. You can always aggregate it up to the age bands that are required for that indicator. And this goes back to the indicator reference sheet. So if you look here, for any given indicator, it will tell you what the age band requirements are. And so it'll say, this is 0 to 4, 5 to 9, 10 to 14, etc. And that will be what you use to decide if you need to aggregate your data up to enter it into Datum or not. The challenge usually in most cases is that your data is, you can be collecting your data at a level that's too high. And then you've got a real challenge because you can't divide it. You can always add two age groups together to reach one Pepfar age group, but you can't really divide. So if you're only collecting, say, over 15 and under 15, or you're collecting 20 to 29, that becomes very difficult then, because we need 20 to 24 and 25 to 29. And so you're gonna have to think about how to change your systems in order to be able to collect the data that's required by the indicator reference guide. Okay, so we'll move on a little bit. I'm going to talk about something called high frequency reporting. So up until now, everything that we've been talking about is the Pepfar Datum cycle. And this is what, Pepfar sits above USAID. So Pepfar is to USAID what USAID is to you as an implementing partner. So high frequency reporting is a USAID requirement. And the way that we've sort of talked about high frequency reporting is what we realized is that the reporting cycle that I just explained to you doesn't let us respond very quickly, because really, if you collect data for an entire quarter, you've got until November 13th. We won't know what's going on in Q4 until at least November 13th, which is a long time in Pepfar terms. And so the OHA leadership asked us to help come up with a solution to be able to look at data more quickly. And so the problem that they laid down is that the Pepfar quarterly reporting cycle does not allow OHA headquarters or the implementing partners to have the data they need to diagnose and take effective action. So the solution is we wanted to stand up a system that implemented routine data use for decision-making at the partner level, so that's you. We limited it to some key indicators that we thought would help measure performance, but we wanted to increase the frequency. And then finally, we were hoping that this would drive greater engagement between the implementing partners and the mission, and then help everyone kind of improve program performance. So for HFR, what we did is we selected a subset of the Mer indicators. Now, if you look here at what the indicators for HFR, they're not new. This is not additional indicators. This is just the same indicators you were collecting, just more frequently. So you've got HTS-TST, HTS-TST pause, TX-new, TX-cur, VMMC circ, PrEP-new, and TX-MMD. And this is multi-month dispensing. So this is the number of patients currently on treatment who received more than 1 month of ARVs. And the slight nuance is that within the MER, TX-cur, current number of patients currently on treatment, is the indicator. And then the number that received multi-month is a disaggregate. So it's a slight difference, whereas for HFR, we collect TX-MMD outright. So what we have here are the disaggregates required. So for HTS-TST, HTS-TST pause, TX-new, TX-cur, and VMMC circ, those are disaggregated by what are called the course age disag. So that's the 15 plus and under 15. And the reason that that's different than what's in the MER is that we thought it would be easier for you as partners to report those data. And it's easier for us to collect them, and it's easier, given that we were asking you to do this more frequently, we thought it would be easier to sort of limit the requirements a little bit. You're still required for MER to report the fine age disags. So there were frequencies. So this is, again, this is the increased frequency. So basically you're being asked to report weekly data every month. So what we want to understand from that is what's happening from week to week, although you only submit that information once every month. So you give us 4 weeks of information at one time. And then the next month, you give us another 4 weeks of information. But the data is broken down by week. So this is all based on a reporting calendar. These are based on, or what are called epi weeks, because we couldn't use, because the requirement was to have this be weekly data. In order for it to work, we had to use epi weeks. So this is why this looks a little bit different than a normal calendar week. And so again, this reference material can be made available to everyone. So the process is we've provided 2 different types of template, a long format or a wide format. The data being collected is exactly the same. You can just see in one, you've got your indicator as a particular column and then a value where you put the value for that indicator. The other one is you've got your indicators going across the top. So you've got HTS-TST under 15 female, HTS-TST under 15 male, etc., going across the top. So whichever of these 2 formats is more convenient for you, given your systems, is the one you should choose to use. Just a quick note about the process. This is everything that happens with HFR data. Now, again, there's a lot happening here. You really need to only concern yourself with what's going on in the upper left-hand corner. So country partners collect weekly disaggregated data at the site level. So you're sort of doing all this stuff here in the upper left-hand corner and then sending it in. And what we do is we do a lot of processing on our side, but then the idea is that the results flow back to you. So you can see, we want this to be useful for you. And so we try to make the results as easy to share back as possible. So one of the things we look at is site completeness. And this is if the site had a target for a particular indicator, did the site also have a result? So basically, what is the reporting completeness for HFR? We also look at something called a weekly target gap. So if your site has, if your site has if you have a target of 200 and your site has a result of 100, then you still need 100 more tests, for example, to meet your target for the year. And so what we do is we take that 100 and we divide it up by the number of weeks left to let you know that week by week, this is what you should be trying to achieve. Explained a little bit better here. So this is sort of it's just a way of us trying to help you understand what you need to achieve at a particular site to meet your target. So for example, here, if you've achieved 400 through quarters 1 and quarter 2, but your target is 1,000, that means you still have 600 to go. So if there's 26 weeks remaining, your weekly target gap is 23. So like I said, you can have this for reference to study later, but we're really just trying to sort of provide benchmarks for you. And then we basically have a scorecard, which is by country, by partner, by indicator. And this just kind of shows week by week how people are doing in terms of achieving their targets. It's a real quick overview of HFR. It's a little bit complicated, and so I'm happy to answer questions now, or your mission points of contact can also help with this. So I'll just pause again for questions.
We don't have any questions right now. Maybe give it a few more go through a few slides as people type in their questions.
Nope, no worries. I'll just wait for a minute.
Sure. Yeah, we still don't have any more questions. Perhaps you can go on, and then if they come up, you can answer them in the next question session.
Yeah, sure, there's no problem. And participants should know that they can ask questions about any aspect of this at any point. So we're going to talk a little bit about effective data use. Now, I've talked all this stuff about how this data is collected, the systems that you put it in, what you need to do, what the requirements are. Now we're going to talk, there's a reason we collect all this data, and it's so that we can use it. I'm going to talk a little bit about, and I'm going to go through this very quickly because I want to save time for discussion at the end. But this is just to give you an idea of how headquarters looks at the data. This does not mean that this is how you have to look at the data. You can look at the data in a way that makes sense for your program, because you as an implementing partner, will have different needs than me as a person on the strategic information team at headquarters. Now, we both will be looking at the same data. We might be looking at it in different ways. So as I said, this is our attempt to show you how headquarters reviews the data. Now, you can do this or you can do your own thing. And we're always interested in understanding how partners are using the data. And so we're going to talk a little bit about that at the end. So, the main thing is headquarters wants to monitor program deliverables and make adjustments and plan for future activities. So is what we're doing working? If you think about that question that we started the training off with, is Pepfar meeting its goals? So we do that to track progress towards epidemic control, because the targets, if we meet our targets, we will achieve epidemic control, because the targets are based on the epi data. So we want to make sure that the point of tracking these results is to see how we're doing towards epidemic control. We have accountability to Congress. Pepfar is under a lot of scrutiny at the political level because it is such a large program with so much money. We have a lot of attention from the political leadership in the United States. And then we have accountability to stakeholders. Now that's your host country governments, that's the ministries of health. This is a collaborative effort. And so we want to be able to talk comprehensively about how we're doing to those different stakeholders. We call this feeding the machine. This is what all this data is for. It's a lot of information, and it's kind of a constant feeding. It needs to be fed frequently. So the two things we're going to mention briefly are port and COP. PORT is a quarterly review, which if you have not heard about already, you most certainly will, because this is basically where the missions presents the Pepfar team in country presents to headquarters. So this is the USAID, CDC, DOD, HRSA, et cetera, Peace Corps, all get together and work on a quarterly presentation. Now, we talk a little bit about level of analysis, and this is an important concept in the way that we do our work. And you see there we've got OU, IM, geography, and population. So there's different, given the way that we collect data, you can present it at different levels. Now, what the presentation is depends, dictates a little bit what the level is that we use to present. So for a port and for a COP, typically we tend to focus on an OU level. So how is Zimbabwe doing overall? Or we talk about it as a mechanism level or a partner level. How is FHI 360 in Zimbabwe doing? And then we talk about it at geography. This gets back to this prioritization question, but how is Harare doing compared to another district? And so this is the way that the questions usually get framed in the port reviews. So you can kind of see here as an example of something like that. This is a trend over time by SNU by mechanism. And so what we're showing here is linkage. Linkage is an important indicator for Pepfar because it tells us, part of the goal, one of the goals of Pepfar is case finding all those PLHIV who do not know that they have HIV. But the second part is linking them to treatment. So finding them is recorded in HTS-TST pause. I found a positive person, but we also want to make sure that positive person was linked to treatment, i.e. they initiated treatment for the first time. So that's TX-new. So what we do is we create this indicator called linkage, which is TX-new, or HTS-TST pause divided by TX-new. And so it gives you a percentage. So you can see here in the very first column on the left-hand side, 82% of all positives also initiated on treatment. This example is using DRC. So Haut-Katanga is one of the PSNUs there. And we've got this broken down. The colors here are the different implementing partners. So at a glance, you can tell in across these three implementing partners, how well they did at this. Are the linkage rates high? So some questions that might come up is implementing partner 1 seems to be doing slightly better than implementing partner 3. Is there something implementing partner 1 can share with implementing partner 3 for them to improve their linkage rate? So we also can look at geography and population. So by SNU1 or SNU2, which is PSNU, and then by population. So the major age, sex subpopulations of interest. This is an example of that. What this is showing is I believe this is viral load suppression by district, by age and sex. And you can see here that some areas are doing very well, i.e. 100% of the under 4s in Shilosawini are virally suppressed. But some areas aren't doing well at all. And nationally, you see about a 70% viral load suppression rate. Now that's okay, but it's not great. And it's certainly what you would see here is that this would give us an overview of how we're doing and where to improve. Then we've got routine program management. So this, beyond these quarterly reviews, is kind of just what we do on the routine level. So how do you kind of keep track of how your program is doing? Now, again, this is the point at which your particular analysis and implementing partner might be different than what we look at headquarters, because you know what you do every day, and you know what data and analysis you need to understand if you're doing the right thing or if you need to do something different. So you could look at this by geography or population. Again, this is a site level linkage rate. So this is by site, how are we doing? So am I doing better in a particular health facility A or a particular health facility B? In terms of linkage, which is that metric we talked about before. This is the same view, but we've just decided to segment it for females aged 10 to 24. For example, if you have an intervention that's focused on testing and initiation on treatment of young women, you might decide that for you, that means 10 to 24-year-olds. And so you would want to see how you're doing there, because you could look at this and say, oh, this looks great, everything is fine. But when you look at it just for the 10 to 24-year-old women, you see it's a different picture. So an example is my program meeting its objectives? So you can compare targets to performance and understand kind of what this means for your program. Now, what this means for your program is really dependent on you, because, like I said, you are the ones who are doing the work. So we don't know, if you need to decide, I need to do more of A or I need to do more of B. We don't know what A and B are. You'd know what A and B are because you're the implementers. So the analysis that you use to get to deciding to do more of A or more of B kind of depends on you. So, when you look at target-based comparisons, so if you look at results versus targets, which is a percentage, it does not necessarily give concrete, specific or actionable information about the dynamics or drivers of underperformance. So we don't know why. We just know that, you're performing or you're not performing. You're on track or you're not on track. So, that's why it's very important to not just look at the performance of one indicator, but to look at the whole cascade. So the cascade analysis attempts to understand the contributors and component parts of each cascade step to more concretely and specifically understand and interpret performance in a programmatically relevant and actionable way. So an example of that is, your AORCR comes to you and says you didn't meet your TX curve target. That's not a great question. Or a great statement, rather. A better way to say it was, you didn't meet your TX curve target because your retention on PLHIV on ART was low. So you might have enrolled a lot of people, but you also lost a lot of people. And the second one should be a more answerable question for you. But still better is you did meet your TX curve target because your retention of PLHIV on ART was low, especially among men 30 to 39. So you can kind of see how it would be very easy to start with the starting point if you did meet your target, and the kinds of analysis you would need to do, which we showed a few minutes ago, to get to the very last bullet point, which is your performance amongst PLHIV on ART of men 30 to 39 is lower than everywhere else, and it's dragging your overall performance down. And again, this is an example, but as implementing partners, I would think that you would rather hear the third bullet point rather than the first one. So, this is, again, we talk about a cascade analysis. This is sort of how we look at it. And you can kind of see here, this is the very basic clinical cascade for HIV. We test people, the people we test positive, we initiate new on treatment, and then those people may stay on treatment. So if you working backwards, are we meeting our curve targets, which is sort of a main indicator of interest for Pepfar. You can look back and say, is there a retention problem? Are we, are we keeping the people on treatment we should be keeping on treatment? Above that, you can look at TX new. Are we initiating enough people? And that's that linkage rate. So of the people we test positive, are they also walking out the door with their ARVs that day? And then the linkage problem. So that's just sort of looking at the difference between HTS-TST and HTS-TST pod. And then we're finding enough positives. So, is our testing program efficient? We talk about a positivity rate. So if you test 100 people and you only find one positive, your positivity rate is 1%. Now that might be okay for your context if you're doing like BMMC, or it's very low if you're doing index testing. So if you sort of look at those problems in the middle, the way that we've kind of worked backwards up the cascade, trying to identify what's happening, you can sort of also then start to layer in these other aspects of an analysis. Is it by SNU? Is it by IP? Or is it among certain age sex groups? And again, I hope this slide here kind of helps you understand why we collect the level of data that we do. The reason we ask you for age-specific testing data is so that we can answer these questions here, because we can't answer these questions without having that level of detail. We also, for testing especially, we talk about, and we know a lot of you do testing programs, so we want to talk about modality-specific testing very quickly. Modality-specific testing is really just looking at those same things, but across the different testing modalities. So other provider-initiated testing and counseling versus index versus other things. And so there's value in looking at that, especially if you're doing index testing, because it is under a lot of scrutiny. So this is an example of that. You can kind of see here your bars are the volume of tests. The dots are the yield or the positivity rate. And you can kind of see that this is Zambia for all sexes, over 15 and under 15. And you can kind of see that volume-wise, for example, this very large bar in the middle, HTS-TST, they have almost 400,000 tests in what's called other PITC. But the yield here is relatively low, just under 5%. Compared to index testing, which has a very small volume of, it's probably around 6,000, but a positivity yield of almost 35%. What this does is it allows you to look across modalities. Like most of your tests are in index, other PITC, but you're getting very high positivity rates from your index testing. So finally, we're just going to talk very quickly about using data for program monitoring, because I want to move to the discussion part of this presentation and answer any follow-up questions. So these are examples that we have pulled either from port slides or from slides that implementing partners have shown us either during a port or during a COP for examples of how they're using data for program monitoring. So this is a weekly performance versus target. So this would be something that's similar to the gap analysis that we showed you. So it's in fact high frequency reporting data that was used to monitor weekly progress, set granular targets, and increase accountability to course correct. So on the right hand side, you see this helps us understand how the performance doubled from 33% to 59% from one quarter to the next. Now, again, this would be layered on with some explanation of what they did, because ideally you would like to say we went from 33% to 59% because we did X, Y, and Z. This is an example from Tanzania. They had poor results in one quarter. And so what they did is they looked at their weekly data to identify a problem. They sent regional teams out to do TA and intensive site monitoring. And you can see after that, the linkage rate increased. So what they did is, the story here is very simple. They used data to identify a problem. They did something to address that problem, and the results improved. So this is self-testing in Zimbabwe. Again, this is an example of sometimes where Mer indicators are not sufficient. You sometimes need to bring in custom data. If you're collecting, as an implementing partner, you might have your own custom indicators that you can use. So the self-testing results at the very lower left-hand corner are, you have the number of kits distributed, the number of results, and then in the final lower right-hand side, you've got the number of confirmatory tests. And so that compared to the distribution in the upper hand, it says that they wanted to ensure that they're reaching males of key age bands. Males are a key target audience for self-testing because they're seen as not wanting to access the healthcare system in sort of the usual ways. And so they're using the graph on the upper right-hand side to make sure, that the number of males, the percentage of males stays good or high relative to the percentage of females. So that's it for the presentation. I believe Nishiva's going to take us through some discussion questions and answer any questions that have come up since then.
Yes, hi. Hi, everyone. Before I move to some discussion questions, are there any questions from what Joshua has presented or from any of the materials that we've asked you to download, such as the indicator reference guide or the Pepfar data calendar? Because I know it's sometimes hard to type questions while you're also trying to pay attention. okay, no problem. I'm going to move us on to some prompt questions that we drafted, hoping to encourage discussion or just to think through different materials. Is it okay if I share my screen?
Sure.
Thank you. Thank you. Can everyone see?
Yes, we can.
All right. So using the Q&A feature or the chat box, or even if you would like to speak, has anyone here entered data into Datum? And if so, what challenges have you experienced transferring data from your MOH systems to your internal systems or Datum itself? The other question, and I'm thinking I can just read these through, and whatever applies, if you'd like to respond in the chat box or Q&A, you can go ahead, or if you would like to vocally respond to share your experiences, that'd be great as well. Have you used Mer or other data to make any program adjustments? And when we say other data, this could be national data, your own program data, if you have data that comes from other sources that are not nationally funded or Pepfar funded, but you still find it useful, have you used those? And how could one use the Mer reference guide to inform their program, such as the tools you use, how you collect your data, how you monitor your program, etc. Has anyone used the data calendar to inform their data reporting and cleaning process? And how could one use the data calendar to inform that process? Because we know that there's some IPs here who are currently implementing an FY20 and might have seen the data calendar before and might have needed it to use it before. And lastly, how does the geographic hierarchy impact your program planning? So I see there's some points in the chat box. And I see a question from Umar.
Yeah, I can take that, Nishia.
Go ahead.
So the question is, are we expected to share qualitative data in form of stories or change from beneficiaries to add weight on our qualitative data? It's a good question around qualitative data. Now, again, what we covered today was the requirements for Pepfar. You may have additional requirements for reporting in your PMP for your project, or internally, your own organization may have additional data that they want you to submit. Pepfar does not ask for any qualitative data per se. There is a section in the reporting called the narratives that we did not get into. And the narratives are simply that. It's an open text field that allows you to use, just describe using words what happened. So for example, if you have a testing program and your testing numbers are very low, as many are right now, you would probably in that narrative write something about the COVID specific restrictions in your country and why that impacted your ability to be able to implement some of your programs. So the narrative section is qualitative technically, but it's not structured. So it's a completely unstructured way for you to enter that information, that supplementary information about your reporting. And again, you'll get more guidance from your AOR COR at the mission, because some AOR CORs want a lot of detail in the narratives. Some of them will have a guide for you, and some won't. But qualitative data per se, no, Pepfar does not require that, but that doesn't mean you might not be able to report it.
We have another question.
Yes, from Thibault, how can we best present on the MEL indicators, or maybe some custom indicators for qualitative impact? Josh, do you want to take this one, or I can? And I'm not familiar with MEL indicators, I'm sorry. Is that Thibault, do you mind responding with what MEL stands for? Thank you. But and Josh and Christy, I don't know if you'd like, you are not exempted from collecting or presenting your data alongside custom indicators. There are a couple of program areas within Pepfar where the Mer Indicators do not capture all the useful information needed to tell a complete story or get a better understanding of how the program functions. For example, a lot of our programs that do community testing, but may not be able to do community treatment initiation, use custom indicators to fill in the gaps and show, hey, the folks that we found who are positive in this community site, we have successfully linked them to treatment. So we may use a custom indicator called TX new linked, or these are folks who are formerly on treatment, but we were able to link them back to treatment after 6 months or 8 months of them being off. So we would do return to treatment, which is now technically a Mer indicator, but started as a custom indicator. So depending on your work plans with, depending on your IP work plans, which might have some custom indicators listed regarding what Pepfar or your AOR or CORs expect you to collect, there are opportunities to present on custom data to help you tell a complete story. Oh, monitoring, evaluation, and learning indicators. Okay, thank you. Josh,
Yeah,
anything to add?
that's a good explanation. You can collect anything you want. Literally, if you as an implementing partner want to collect something, you can work through the Ministry of Health and collect anything that you want. You are required, if you have targets for Mer indicators, you are required to report those Mer indicators in the way that's specified in the indicator reference guide. Above and beyond that, you can do anything you want. Now, in terms of crafting an analysis, you should use everything that you think you need to use. And if you're talking about submitting an analysis to the USAID mission, by all means, please include qualitative information, custom indicators, anything you want. It all helps. It's all very useful for us. And if you think it supports your approach, if you think it helps you defend your results, please, by all means, use it. What we tried to do with this presentation is just present to you what is required, what is the minimum requirement. But you have a lot of flexibility beyond that requirement to do what you think would be helpful.
Sorry, I had trouble getting myself off of mute. Thank you, Joshua. So I can't see the chat box, but were there any responses related to some of our post-webinar prompts? Or if comfortable, would anybody like to share their experiences related to using Datum, how the resources such as the Mer Indicator Reference Guide and the Pepfar Data Calendar were used to help plan your processes and design your tools?
Nashiva, I can see I have access to the chat box. So far, we don't have any feedback on your prompted questions.
Okay, no problem. Thank you. I can give some examples that we've seen. And as USAID SI folks, only implementing partners are allowed to enter data into Datum. We are technically not allowed to do it on behalf of IPs, but we have worked with IPs to help streamline their processes. And for example, with the Pepfar Data Calendar, what we've seen and what some of you might have already experienced is that the times and the deadlines expressed in that calendar are used for internal planning processes. So a lot of IPs have monthly meetings with their AORs, CORs, and the technical teams at the missions. So they use the Pepfar Data Calendar to inform when the data that they're preparing to enter into Datum should be ready and cleaned. When they have their monthly meetings, how often they should have it and what they should focus on as far as if they're talking about reaching their targets or improving linkage or retention or other metrics that are important to the program. And I've also seen the Pepfar Data Calendar used to inform if an IP is going to make any changes to their processes for collecting data or changing up their systems. It's also been very helpful to understand when the best time to do that would be. Josh and Christy, I don't know if you have any examples from your experiences. There's so many. So if you guys, if participants have suggestions or experiences, feel free to just share them.
We have, Nashiba, we have 2 hands raised. Would you like me to allow them to talk, those who've raised their hand?
Yes. Yes, if you can say your name and what country you'll be working in, and also the indicators you'll probably be collecting data on. Thank you.
All right. Bitsa, I'm going to allow you to talk. You can unmute Bitsa Ginditsa. I'm sorry if I'm pronouncing your name wrongly. You can unmute yourself and you should be able to speak if you could unmute yourself, Bitsa. We also have Sandia, who has a raised hand. Bitsa, please go ahead and speak. We haven't tried having participants speak before, so I'm not so sure if the problem is on our end or on the participants' end, but I've allowed them to talk. Somehow they're still on mute, so maybe it's the setting on our webinar. I apologize for that.
No worries. I'm happy that they volunteered. If the audio isn't working so well, we can use the chat box. Someone earlier asked about the Mer indicators, and a lot of IPs that I've worked with have used the reference guide not only to help with their data collection, but specifically design the tools that they need. And a lot of ministries who are collecting similar indicators to ours have used the reference guide to inform their own systems, as far as even dialog boxes, outputs, to make it easier for everyone accessing the data to use it and in different tools and different statistical packages and so on. So one way the reference guide helps is that it defines exactly not only what needs to be collected, but how frequently it should be collected, at what level. It defines, for example, for testing, what counts under the modality, and even more important, or just as important, what doesn't count under the modality, so that way we're not overcounting or undercounting our data. And a lot of IPs and missions work with ministries of health to improve the systems that everyone has access to report the data. So that's one example. I can't see the chat box. So if anybody would like to read, if anyone's put any of their experiences there, we'd be happy to see it. Oh, I see it now.
We don't have any feedback on that, but perhaps you can take a look at that Q&A segment. There's some questions there.
Yes.
So I can read some of those. From Elizabeth, we've got, thanks for the presentation. Where can we find additional tools or resources to enhance Datum use? There's a lot of potential resources like the data review tool within the Data Genie. And we may not be fully utilizing tools. That's an excellent question. Yes. So it's so Datum, we did not touch really much on how to use Datum for data analysis, although there are a number of options. Datum has a pivot table app, which allows you to build sort of a data table that you can kind of look at it by subpopulation, by geography, by time period, etc., fairly easily. And then you can turn that into a chart. So basically, after you've created a pivot table in Datum, you can, there's an option that says like convert to chart. They also have a new app called the Data Visualizer. And what that is, it's a little bit easier way to do what I just described. And so I would recommend, I'm not sure if there's trainings on the visualizer yet, but it's sort of a drag and drop, point and click way of building a data visualization. So both of those are within Datum. And the nice thing about using those is that it will, when you log in, it will default to your program. So you won't have to worry about sorting through different countries or different programs, because you will only ever see the data that you have. And so that's one option. You know, we sort of talk about different systems, but really there's a lot of functionality within Excel. If Excel is the only tool you have at your disposal, there's ways to get the data out of Datum. And then you can do lots of different kinds of manipulation in Excel. That's about all I can think of. Nishiva, do you want to add anything for that question?
Sure. The only thing I would add is the Datum Help Desk page, which is open to the public. You won't need a login to access. Also has a lot of resources, such as the guidance for using the data review tool and Datum Genie are available there. The calendar, the indicator reference guide. It also, the Datum Help Desk page, which you can access by going to datum.org and going to the bottom and selecting Get Support. I'm sorry, I don't have a screenshot here. They also have the releases as far as things that users of the data should be aware of when they're accessing the data, whether it be in Datum or in Datum Genie. So that would be the only thing I add. And plus the resources on that page, you're allowed to share because it's open to the public.
We have a question from Table. We're having no dating in our organization. How do we get about it to acquire it or maybe integrate on our system?
So that's a good question, Thibaut. You know, Datum is the system that is owned and maintained by Pepfar, and they have created it so that Pepfar implementing partners can enter data into one system. So if you are a prime recipient, you should be able to have a login to Datum. If you are a subrecipient, you should work with your prime partner to understand what access options may be available for you. But it is a web-based system, so it's not as if it's not something that you would necessarily download and open up on your computer. So yeah, that's what I would suggest, is that you speak to either, if you are prime, you have the right to have an account, and if you're a sub, you can talk to your prime. There's another question that says user rights in Datum are different. Can one person have multiple user rights, meaning enter, review, and submit? It's a very good question from Deza. So yes, user rights are different. Now again, you have an account in Datum, and with that account, you have certain user rights. This is what I've sort of been saying about if you're an implementing partner, all you have the user right to look at is the data for your program. And they will then, if you're an implementing partner, you automatically have the right to enter, review, and submit. For example, with my account, I can't enter data because I'm not an implementing partner, because only implementing partners can enter data. But if you have an implementing partner account, and when they set the account up, they'll basically say, oh, you know, you're an implementing partner, yes. At that point, you'll have the right to enter data. I will say that you have to have some caution, because you can enter data, any data for any indicator at any site, not just those sites that you're responsible for. So it does require a little bit of thinking about how you're going to enter the data. But all the tools are available to you. The Datum favorites that you would use for review and validation, and the data review tool that you would use for review and validation. Those will all be available to you.
We have, oh, go ahead.
We have a comment on the chat box from Sandia regarding challenges. The transfer of MOH to Datum. Frequent changes in indicators or ages. She highlights that as a challenge. Maybe one of you can speak to that.
Definitely, because that's a good point to bring up. When we think about Pepfar, we work in over 40 countries with different MOHs that have different systems. And recently, within the past 3 years, Pepfar moved from age bands that were a bit broader. So they went from coarse age bands, which are 15 plus, to under 15. Then they moved to broader age bands with a mix of some finer ones. So you'll see some 5-year age bands up to 25, and then you'll see a 10-year age band, and then you'll see 50 plus. But within the past 3 years, almost all of our indicators have been moved down to 5-year age bands. And when that started, not every ministry and not every department of health within the countries we work in collected their data to that level of disaggregation. The data that they collected wasn't always down to the 5-year age bands, or if it was, the age bands were different. For example, we see this with a lot of pediatric data collection tools. where they'll do under 3 or under 4 or under 2, because those are the age bands defined by that ministry to be the most useful. The Mer indicators do get, I want to use the word revised because that's the word we use in Pepfar, but they do get reviewed on a yearly basis. So far it's been a yearly basis, and updates or clarifications to the indicators have been made to make it easier for IPs to interpret the definitions and apply the definitions. And occasionally there might be a new indicator added. But the challenge of age bands specifically that are not aligned with MOH systems is still pretty present in a lot of countries. And there have been some creative solutions that IPs have used to get around that. For example, if there's an EMR that has patient level data, some IPs work with the ministry so that they can pull de-identified data and sort the data so that way it aligns with Pepfar age bands. Josh, I don't know if you have anything to add as well.
That's a good overview. I mean, again, it's a little bit of a complicated question, you know, because sometimes it's just not in the right format. And I think you need to work with your mission colleagues to understand what options are feasible and what you may be able to do. And I would just suggest, you know, because there are many different scenarios, it's very difficult for us at headquarters to sort of give very specific guidance. But I think on this call, we have representation from implementing partners who have seen this problem and come up with solutions. So I think that's maybe a good idea for our ASAP colleagues to help us think about like a community of practice so that amongst yourselves, you can share these experiences and talk about solutions.
Thank you. So we have some additional comments. I'll read the first one, that the team is very important to Mariam because she's responsible for monitoring and evaluation, but she's looking forward to the French session because she's a French speaker. And another comment is I have not used MER. That's a comment from Nobat to design any tool because I'm not at that level, but I have used it to understand the indicators that I work with. So those are just comments from Mariam and Nobat.
Thank you.
And Mariam having a French version of the same session where right now we're working on identifying the date, and we'll be happy to share it as soon as we've confirmed the date for the French session.
And thank you guys for those comments. It's great that I encourage, I know it's a long read, but I encourage everyone to read the indicator reference guides and the definitions, because these definitions are not uniform across different programs. So your MOH might define someone who's currently on treatment differently than what Pepfar does. And it's important to understand how Pepfar is defining specific metrics, because you want to make sure that when you're reviewing your data and when you're analyzing your data and you're making strategic information decisions based on it, that it's aligned with how your mission sees it, who is informed by Usaid, who is informed by OGAC would see it. For example, in some countries, viral load testing is the national guidelines will say for someone who's suppressed maybe once every 12 months, others might say once every 6 months, others might say once every 3 months, depending on the circumstance. For someone who's currently on treatment, Pepfar currently defines being on treatment as every 28 days, but other countries might have a different definition that they use. So I strongly encourage every IP to especially read the definitions for the indicators that they're collecting data on, but also the other indicators that they don't think they're collecting data on, but you might find out through the definition you meet those requirements, especially for testing and the modalities, because for a lot of us, that's the beginning of our cascade. Also, if you're collecting data or reporting on some of the prevention indicators, such as PrEP-New, current on PrEP, the key population prevention indicators, the key population disaggregates for testing and treatment. Those are key because you most likely have to double check them against your country's national guidelines. So thank you for that. Josh or Christy, anything to add?
Not for me. So Mer, I think you could maybe close a few minutes early.
Yeah, sure, absolutely. Thank you. Thank you so much, Joshua. Thank you so much, Nashiva. And thank you so much, Jason, for helping us lead and for leading our webinar today. We really appreciate. Thank you, everyone who made time to attend this session or this webinar. We really appreciate you taking time to be with us for this very interesting and robust webinar. Thank you very much. We will be sharing more information on when we'll have the same version in French as soon as we confirm the dates. Thank you, everyone. We really greatly appreciate your participation. Bye for now.